I'll start when we were children. Liz and I have known each other since we were kids, and we kind of got together 30 years later. I was diagnosed about 8 years ago with prostate cancer that was spread to the bone, which is stage 4. It was important for me to plan ahead with the advance directive because I didn't want to burden family members, of course, for me and also my wife. I don't want to burden her with too much.
When Michael and I were first, our early part of our relationship, he really wanted to be pretty transparent and let me know what had been going on and what his medical condition was. And being a nurse, he thought, well, it might be helpful to me to kind of understand. I'm not directing things, it's really about his choice, his wishes, what he wants to do or not wants to do, and when he wants to do that.
Advanced care planning is a gift that we can give to our families to let them know what we would like should we become ill, terminally ill, or disabled to the point where we are not able to express our desires.
Don't make it an end-of-life conversation. I don't want to shy away from that. The end-of-life conversation is an important one, but make it a conversation about wishes. And it should be intergenerational. It should be children having conversations with their parents and grandparents and vice versa. I want to have a conversation about what my wishes are and what your wishes are. Maybe we can just share that with each other.
It can be a natural conversation that people start with their loved ones. Just saying, by the way, I've been reading about advanced care planning and I want to give you a gift. This is my gift to you. So somebody in the family needs to start the conversation, and then it can go from there.
There are a variety of elements of advance directives, and part of it depends on the state that you live in. There are healthcare proxies, there are power of attorneys, there are other forms that exist at a state level. But the important thing to know is what the different forms do in your state. A good resource for this is caringinfo.org, which is a place where folks can go to and search by state to determine what forms exist in their state and what the forms do. If folks don't have an advanced planning document already executed and something happens, it's often too late to execute it. They may lose capacity, they may lose the ability to make a decision themselves. So that also includes the ability to enter into one of these advanced care documents.
Having those conversations before a crisis occurs or before decisions are needed is really a gift for a whole family. It doesn't matter who starts the conversation. It's a gift that removes the burden of uncertainty for some members of a family and then puts a clearer line of responsibility for those who are the decision makers.